The strong commitment of Nova Scotians to follow public health guidelines and look out for each other have allowed us to keep our students in school. And experts agree the best place for students is in the classroom. The in-school experience is vital to a young person's development and well-being. Schools are so much more than a place to learn. Schools are where students build lifelong connections, friendships, they play, they access food and mental health resources. Throughout the pandemic, we've acted on the advice of public health and placed a priority on the safety of schools to protect in-person learning for students. I've discussed the return to school with NSTU and PSANS and have heard their needs and suggestions for continuing in-person learning. I've shared these thoughts with public health, and many of these suggestions have been incorporated in the revised back-to-school plans. We have seen the situation evolve and we're learning to live with COVID. For now, this includes following new guidelines that offer layers of protection to slow COVID spread to protect our most vulnerable. Based on the advice of public health, students will resume with in-person classes on Monday, January 10th. We'll be using the layered approach that has been so successful in our schools. Learning centers in Nova Scotia's public schools, which we know are a vital resource for many students and families, will open on Tuesday, January 4th. With the exception of Chignecto Central Regional Centre for Education, which will open their learning centres on Wednesday, January 5th. This extended break will allow for staff who will report to work January 4th through 7th to prepare for the return of students, including planning for best practices on slowing the spread of COVID. We will be re-implementing some of the past practices that have been proven to be successful, limiting movement, reducing numbers in places like cafeterias, removing excess furniture to allow for more spacing in classrooms. We continue to ask parents and staff to stay home if feeling even a little unwell and to be diligent about wearing masks properly. We also continue to ensure that ventilation systems are maintained and operating as they're supposed to. We have maintenance available on a 24-hour call-in basis. We've increased cleaning in our schools in accordance with advice from public health. The extended break will also allow for families to monitor for symptoms before returning to school and to book vaccine appointments. The COVID-19 pandemic has been stressful, and I understand we are all tired. Parents, teachers, even students may have concerns about returning to school. Public health has assured us that schools remain safe. They remain a safe environment for students and for staff. In closing, I'd like to thank families, teachers, administrators, staff, and students for doing their part to keep us safe during the pandemic. We will continue to get through this, and will continue to lead by example to our young people by demonstrating kindness and resilience.
Our approach to returning to schools is about balance. One of our key priorities has always been to keep children in school whenever possible. The concerns about controlling the spread of what is generally a relatively mild disease in children need to be weighed against the clear harms and risks associated with children not being in school and learning at home. School is so important in so many ways. For some children, it's their safe place where they get the most support physically and emotionally, and many children are not able to learn effectively from online from home. I know this shift will be difficult, but it is the right path forward. There will be layers of public health measures in schools to protect students, teachers, and staff. These have proven to be effective throughout the last 2 years. And so things like reducing movement activities within a school will help minimize the spread of the Omicron variant, protect everyone, and keep students in school. A key component is masking. We also need to make sure people are wearing the right masks to ensure they have the best protection. That means a 3-layered cotton mask for children and students. The 3 layers and a proper fit are even more important now with the Omicron wave. There are some situations like healthcare settings where other types of masks are recommended and required, like a medical mask or an N95. And we're currently working now with our colleagues in occupational health and safety on the use of these types of masks by workers in non-healthcare settings. We'll have more to say about that in the coming days, but for students and the general public, a 3-layered mask is now a minimum. And just a reminder that students, teachers, and staff were given 3-layered masks, cloth masks at the start of the school year, and more will be provided. I need to come back to vaccination, and the most important thing we can all do is to continue to get vaccinated, whether it's close to 40% of the 5 to 11-year-olds who are not yet started their primary series, or people who will become eligible for their booster dose of vaccine as their age cohort becomes eligible. We also need to remember that it's key that to keep our schools and other places safe is that if people are sick and have cold or flu-like symptoms that could be COVID, they need to stay home and follow the public health measures and advice for testing and isolation. Back to you, Marla.